and it traverses optic tract. Before that, it passes through the large nucleate body, inferior nucleus, then continues at optic tract and optic radiation to the optic nucleus, that is area number 17. So this is the structural anatomy of retina and optic nerve, and we can see it is nearly more than 4 millimeter in thickness, rounded structure, okay, and without blood vessels, where it is coming according along with the central retinal artery and central retinal vein, which is in the sides. Okay, here we can see the central retinal. There is a sheath is there. So when we are removing the sheath, we can see the nerve completely alone. Neural sheath we call it as neural sheath. So you can remove the neural sheath. This is deep fascia, and this is the branch of optic nerve. Okay, blood vessels, central retinal blood vessels. And this is fat. Okay, this is fat. We can remove like this. Okay, and the area where it enters in the eye is called it as optic disc. Okay, we can see from the interiorly. You have done dissection, no? You first year is it done dissection, no? You call it blended dissection. Then we can see the muscles. There are how many muscles are there in the eye? This is optic nerve, that's the most part. How many muscles are there in the eye? Extraocular muscles we call it as. There are 4 recti and 2 oblique and 1 in LPS, levator palpebral superioris, and again 1 orbicularis oculi, which is the concentric muscle supplied by the facial nerve around the lid. Okay. Any other intrinsic muscles are there in eye? It is there. Muscles of nerves. Again, sphincter pupillae and dilated pupillae. Okay. These are intrinsic muscles. These are extrinsic, extraocular muscles. We will see the fibers of muscles. You can see that these muscles are originating in the from the extraocular muscles or recti muscles are originating from the sclera and inserted into the common tendinous in the so we know that just above the cornea it is inserted and originated from the common tendinous ring behind the eyeball. So that's why it is moving. It is actually superior orbital fissure. There is a common tendon which is behind the eyeball. We call it as common tendinous ring, and it is inferior to, it is just below the superior orbital fissure. From there it originates and it inserts to the insert part of the sclera 1.6 millimeter away from in the superiorly, 1.4 millimeter inferiorly, 1.3 in the left and 1.3 in the right. You have to go and learn the correct measurement. And during surgeries, first we will ligate the superior rectus muscles by using a vessel to control the eyeball movements. During all the surgery, the eyeball is fixed by using an eye speculum and followed by a stitch in the scleral muscle, that is a superior rectus muscle. Once the rectus muscle is tight, it will never move. Okay. And we can see the rectus muscles first. You can take it out. You can take it out. So eyeball is actually seated like this. So retina will be always to the medial side. So like that we will see the direction. And inferiorly and medially the retina, optic nerve. It goes to upwards, but it forms like that. Okay. So eyeball is like this, and we can see the optic disc is like that. It goes like this, it will be like this. So this is always a right turn. Like that we will find how we will identify the side of them. It's a right turn. It's a right turn. You can see the inferiorly and medially the optic nerve. If it is left eye, just opposite. The other one will be left optic. Superior rectus muscles. Okay. Actually, there is a real gap. Just only a small gap between the rectus muscles. Altogether, when we are seeing from outside, it will be a continuous ring. But actually, some fibers are superior, and there is a gap between the medial rectus, and there is a gap between the lateral rectus, and there is a gap between the inferior rectus. There is a gap. We can dissect like this, and we can take it out. You see, this is the medial rectus. The fibers of rectus muscles. You can separate like this. Understood? So there will be a gap in between the muscles. There is an area of muscle-free area that usually separates the lateral medial area. Okay, lateral and superior like that. A small area or small fibers of obliquous muscles also we will get if you are very keenly observing the membrane. This is conjunctiva. This is the conjunctiva, which is a freely movable membrane over the sclera. It's a type of mucous membrane. Okay, this is the conjunctiva. You heard the term conjunctiva? Conjunctivitis, we very commonly use conjunctivitis as it is a part of vascular tissue, and it may get very frequently in the inflammatory diseases. We call it as conjunctivitis. Allergic or pathological or anything, traumatic conjunctivitis or anything, viral conjunctivitis, bacterial conjunctivitis. Okay, so the effect of the is a conjunctiva. This is the conjunctiva, and conjunctiva is continuously over through the cornea. The first layer of cornea is formed by the conjunctiva, corneal epithelium. It's a transparent single layer of hexagonal cells. Okay, regenerating possibility is there. And second layer is actually what are the layers of conjunctiva of cornea? How many layers are there?
6 layers.
What are they?
Epithelium, Bowman's
membrane, conjunctival epithelium, Bowman's membrane, substantia propria or stroma, then desmoid membrane and endothelium. What is the difference between membrane and epithelium? What is the difference between membrane and epithelium? First one is epithelium, isn't it? Corneal epithelium. Second one is Bowman's membrane. Bowman's membrane. Why membrane it is? Why? Because it is membrane. The first one is the cells which is hexagonally adjusted and kept. Usually it contains 2 to 3 layers. 2 to 3 layers of palisade arrangement. 2 to 3 layers of cells and hexagonal cell or cubical cells. Second layer is a membrane. It is continuous. We can separate as it is a membrane. The first layer we can't separate as a membrane. It's actually cellular structure. That's the epithelium. And epithelium means always it regenerates. Where membrane does not regenerate. And third one is substantia propria or the stroma, which is the thickest layer. 80% of the total cornea is contributed by the third layer. On substantia propria never regenerates. So if an penetrating injury happens to the cornea, which pierces through the stroma, usually what will happen? It never regenerated, a pinpoint injury. And what will happen? Due to the high pressure inside the anterior chamber, the contents of the anterior chamber bulges through the prick. If the stroma is injured, and it just appears as a God's fecal matter, we call it as Ajjagai never test. Or it is the prolapse of iris muscles through the injury. We study in our Krishna Mandala. Okay. So we see. So these are layers, these are the conjunctiva. So muscles is over. Okay. You can, if you want, you can use much time. You can separate it like this. Okay. So we will go to we'll dissect it. And this is the conjunctival membrane. So I will dissect it. And this is the cornea. Appears as a plate-like structure, but it's a thin membrane. Dissect from the junction. Actually, limbus we call it as. Sclerocorneal junction we call it as limbus. You can see that it is going inside. See? Now it is inside. So we reach in the anterior chamber. Our forceps is reaching the anterior chamber. ശ്രദ്ധിച്ചില്ലെങ്കിൽ എന്ത് വരുന്നറിയാം, അതിൻ്റെ അടിയിലത്തെ രക്തമൊക്കെ മുറിഞ്ഞു. Shastra is not having pile. Sharpness illa. ഒരു കനാലോഷലം ഉണ്ടായിരുന്നു, മുറിഞ്ഞു പോയി. You heard canaloshlam? What is that? Very delicate dissection only we can separate canaloshlam. Okay. Otherwise what will happen means it is just a border to the limbus now. I tried best, but it is not possible to get. Separate the cornea. So the aqueous humor will come out. Aqueous humor is what actually? What is aqueous humor? Aqueous humor is?
Anterior chamber. Anterior chamber.
It is a fluid in the
Anterior chamber.
not an anterior chamber, it is an anterior segment. Secreted in the posterior segment, drains through the pupillary margin to the anterior chamber, and it nourishes the avascular tissues of the eyeball and drains through the episcleral veins, trabecular meshwork, episcleral veins, canaloshlam to the superior jugular vein, last jugular vein. Now we can see a brown structure behind. That is the iris muscle. This is the iris. The fibers of iris. I put a light. Somebody put a light. Cornea is transparent and colorless. We appear cornea is black only because of the iris colors. You see that? I separated iris without making injury to the iris. Okay. Take out the cornea. You take out the cornea. Aqueous humor coming out. Okay, yeah. Now it will, the shape will lose. Cornea become a membrane now. Aqueous humor is draining out. You see? Okay. The structure of cornea is lost. Become a membrane. Okay. And the aqueous humor is gone outside. Yeah. You see the iris. You see the iris. Okay. This is the iris muscles. These black structures are the iris muscles. This is cornea. Okay. Hold it. ഇതൊക്കെ കട്ട് ചെയ്തെടുക്കാൻ ഇതിലേക്ക് പോയില്ലേ, സ്ട്രക്ചർ പോയില്ലേ. ഇനി അത് അക്വസ് ഹ്യൂമർ പോയി കഴിഞ്ഞാൽ പിന്നെ അതിനെ പിടിക്കാൻ കിട്ടില്ല. We have removed the cornea. You see that? Iris is there. You see the transparent cornea now? The transparent cornea. Understood? This is a transparent cornea. Okay. It's a membrane. It's a delicate membrane. Okay. And behind that, our iris muscle is there. Okay. The transparent cornea. Understood? No, it is only a membrane. Okay, it is not a cup-shaped. Okay, it is not a saucer-shaped plate or something. It is just a membrane. Only because of the intraocular pressure, it maintains such a shape as a saucer-shaped plate. And beneath the color is actually due to the iris muscle that is dark brownish in the red engine. Okay, so due to that actually we feel it as our cornea is as black. Okay, actually it's not Kaidimidi, it is Sutadimidi. Sit down. Of the cornea, immediately what we are seeing, the iris, the half portion I protect and half portion I remove. Okay, this is the, only for understanding I removed the half portion. This area I removed the iris, and this area is the iris muscles. You understood? You take a photograph of this, okay, and we can see the our lens, human lens. You notice that this is Bullseye lens. Okay, so we'll have a capsule either in the lens. Okay, I'll see you how to separate the capsule. This is iris muscle. So when we are putting dilator, no, these muscles will undergo contraction and this area will be smaller. Actually, this area pupillary margin. It's actually pupillary margin. This will be exposed. I will incise it. Okay. Iris muscle I will remove. Understood? What is iris? I remove the iris. Now what we are seeing is the lens. This is the crystalline lens. So there is a capsule is there. I will remove the capsule. This I will remove first. the iris and the remnant of the cornea. The various corneas remain here. Lens. Okay, the lens. So we'll remove the lens now. Okay, we'll remove the lens. So one area of the sclera we will cut. Then only we will get the choroid structure. Okay. Sclera made an injury over the sclera, and whenever we are giving an injury to the sclera, vitreous humor bulges out. You see the vitreous is coming. This is the vitreous. It's a cellular structure. This is the vitreous. So just like a semi-solid structure. So after injuring on the sclera only, or dissecting over the sclera only, we can see the lens capsule and suspensory ligaments. The ligament is I call it a suspensory ligament, which attach the lens and protect the lens from shifting or displacement. This is the suspensory ligament. You see, now I am cutting that. Suspensory ligament or sonule of sin. Actually, this lens is the portion which separates the eyeball as anterior and posterior segment. And this is a crystalline biconvex lens. I will take it now. The problem is when we are removing the lens, it always drags the vitreous along with it, as it is connected to the Cloquet canal in the intrauterine life. And again, this vitreous is attached to the retina. Altogether, it will come back. So whenever we are doing surgery, I used to tell that when we are doing PPV or vitrectomy, along with the vitrectomy, usually the retina will get detached. Okay, you can see that we are taking the remote. Okay. We are taking the lens. Okay. This is the optic disc and the optic nerve. വളരെ ശ്രദ്ധിച്ച് ഇതിനകത്തേക്ക് നോക്കുക. നമുക്കിവിടുന്ന് വിട്രസിലൂടെ നമ്മൾ ഫണ്ടസിൻ്റെ ഫോട്ടോ എങ്ങനെയാണോ കാണുന്നത്, ഹൗ വി സീ ദ ഫണ്ടസ് ഫോട്ടോ, ഓർ ബൈ ആഫ്റ്റർ ഡയലറ്റേഷൻ ഹൗ വി സീ ദ റെറ്റിന, വി ക്യാൻ സീ ഡയറക്ട്ലി ത്രൂ ദ, this is aphakia we call it. The condition we call it aphakia, where the lens is absent from its original position. This aphakic eye is high.
Flash, can you please?
Same structure,
Same structure. That is optic disc. This optic disc.
ഇവിടെ ക്യാമറയിൽ കാണാൻ ശരിക്കും
light. That is optic disc. Okay.
photo.
Now you see that retina intact. You see that? All of you. Dress gel.
To remove your